Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today I'm going to go over self-muscle work for the cervical spine. The cervical spine is the medical name for the neck. What I'm going to be doing is explaining and demonstrating how you could perform muscle work on yourself to help reduce muscle tension. When you are performing this, always make sure that you use mild pressure. Never use moderate pressure, never use severe pressure or intense pressure. Always use mild pressure. Never put pressure on an area where there is numbness, tingling, or burning. Never put pressure on an area where there is a bruise. Never perform any type of muscle work on an area that elicits any type of symptoms, including nerve pain, which is numbness, tingling, or burning. Never perform this technique if it causes dizziness, vertigo, lightheadedness, ringing in the ears, or if it just causes simple muscle pain. You want to avoid using too much pressure. These are all the precautions that you want to take because you want to get benefit from this. You don't want it to make your condition worse. Also, you want to check with your medical practitioner before performing any type of self-muscle work. Please make sure that you check with your doctor to make sure that this technique works for you. And again, always use mild pressure. You are not trying to be in a contest to see how much pressure you can apply to your own muscles. If you do that, you are asking for trouble. So please use mild pressure. Never perform any type of self-treatment or any exercise that elicits or intensifies symptoms. The cervical spine is the medical name for the neck. When performing self-muscle work on the cervical spine, you always want to work through the entire course of the muscle. And also, if you're using one of the techniques where you are moving the neck, you always want to move through a symptom-free range of motion. There are 4 different techniques that you can use. And again, they are all done with mild pressure. You're probably going to get tired of me saying that, but that is the most important thing while performing self-muscle work is use mild pressure. And then the second most important thing is to never perform any type of self-treatment or exercise or move into any position that elicits or intensifies symptoms. The 4 techniques that I'm going to demonstrate today for cervical spine muscle work include holding a static pressure point or trigger point therapy with the neck in a neutral or relaxed position. Number 2 is holding a static pressure point or trigger point therapy with the neck in a stretched position. Number 3 is applying a moving or sliding pressure while the neck is in a neutral position. And number 4 is applying a moving or sliding pressure while the neck is in a stretched position. Again, always use mild pressure no matter which one of these 4 techniques that you are using. If any of these techniques elicits or intensifies symptoms, please stop immediately. Technique number 1 is holding a static pressure point or trigger point therapy while the neck is in a neutral position or a relaxed position. For example, you can find a spot, say right over here, and apply a mild pressure to that spot while the neck is in a neutral position. Hold mild pressure for 2 to 6 seconds and then relax, and then find another spot on that same muscle and apply mild pressure for 2 to 6 seconds. Now the second technique is exactly the same except you have the neck in a stretched position. So if you want to perform it on the right hand side of the neck, place pressure on that tight spot in the muscle, put the neck in a slightly stretched position. You want to make sure again that there are no symptoms in the position that you place your neck in, and apply mild pressure for 2 to 6 seconds. When you're done, release that pressure and move to a different spot along that same muscle. Now, number 3 is applying sliding or moving pressure when the neck is in a neutral position. So on this one, you can use any of the fingers that you want to, it doesn't matter. It's a little bit easier for me to demonstrate it while using the finger pads on my second and third finger. We're going to hold the neck in a neutral position, and we are slowly going to slide along the course of the muscle. Start at one end of the muscle and work to the opposite end. And then the 4th technique is you are applying sliding or moving pressure with the muscle in a stretched position. So I'm going to work on the right hand side. I'm going to bend my head to the left and slightly forward, and I'm going to apply mild pressure and work the entire course of the muscle. You always want to use mild pressure, and this technique can be performed every day or every other day. You don't want to do it too many times throughout the day. Now, once you have finished performing it on one muscle, then just move to the next muscle. I know I said this many times, but please use mild pressure. It is not a contest to see how much pressure that you can take, and it is also extremely effective if you just use mild pressure. You don't want to end up hurting yourself. You don't want to end up doing further damage or causing bruising, because if you cause bruising, then you cannot perform it the next day or for a few days. Never perform this technique over an area where there is nerve damage, where there is area where if you press down, it can elicit symptoms such as vertigo, anything such as dizziness, lightheadedness, even ringing in the ears. You never want to perform any type of self-treatment or any type of exercise that elicits or intensifies symptoms. This is a technique that you could perform on yourself to help to reduce muscle tension. Always check with a medical professional to make sure that you could perform this technique on yourself before applying it. Again, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you for watching my video on cervical spine self-muscle work. Thank you everybody for watching today's video on spine health. Always remember, never perform an exercise that elicits or intensifies symptoms. Always work through a symptom-free range of motion. Always check with a medical professional before starting any type of exercise program. Please feel free to like, comment, and subscribe. You can visit my website, championshipchiropractic.com, where you get information on my book titled Running, Maximize Performance, and Minimize Injuries. And you could also find my blog on my website. My blog contains articles on spine health, sports medicine, chiropractic, health, fitness, and nutrition. Thank you again for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.